A&P students, we have reached the end of the material for A&P 1. Our last topic to discuss is the autonomic nervous system, and although our discussion of this system will be brief for this course, for those of you going on to a career in medicine, this discussion is just beginning. Many of the medications that are prescribed have their effects at the synaptic level of the autonomic nervous system, and you will most definitely be learning more from here. Many of you have already heard of the phrases fight or flight and rest and digest, and what these terms indicate is that the two different motor pathways of the autonomic nervous system have global effects, and that is true. But what may be misleading about these terms is the impression that when one system is turned on, the other is turned off. These are not all or none systems. In reality, both systems are working simultaneously, and their effects are opposite to each other. And depending on the needs of the body at each moment, that balance will tip toward one system having a greater effect than the other. And so when our sensory system detects some sort of potential danger or stress, our bodies are designed to tip toward sympathetic tone. Whereas if we're relaxed and reading a book, or maybe we've just eaten a meal, we are tipped toward parasympathetic tone. The majority of the effectors of the autonomic nervous system are the viscera of the body. Surprisingly, if the autonomic nervous system was cut off from these viscera, they would still function. It's the autonomic nervous system that makes adjustments based on the body's needs. The organism would survive without an autonomic nervous system, but it would not be able to adapt, and that could be dangerous. The autonomic nervous system is the motor control system for smooth muscle, cardiac muscle, and glands. So all of the viscera, blood vessels, and the glands of the body. The sympathetic system arises in the lateral horn of the spinal cord from T1 to L2 and is sometimes referred to as a thoracolumbar system. Depending on the organ system and the specific location within the organ system, will depend on the effect that the sympathetic system has. In general, the sympathetic system will increase blood pressure, increase heart rate and respiratory rate, as well as sweating, and dilate the pupils. It will increase blood flow to skeletal muscles, decrease blood flow to the gastrointestinal and genitourinary systems. The parasympathetic system arises from nuclei in the brainstem and is carried through the cranial nerves, and from the lateral gray horn in the sacral regions of the spinal cord, and is carried through sacral nerves. In general, the parasympathetic system will decrease heart rate and respiratory rate, will constrict the pupils, decrease blood flow to skeletal muscles, and increase blood flow to digestive and genitourinary organs. Again, we will study these effects in greater detail when we get to each organ system in A&P 2. Autonomic regulation is accomplished through visceral reflexes. Like all of the reflexes that we've studied, they include receptors, afferent neurons, interneurons, motor neurons, and effectors. These reflexes involve an afferent or sensory input that is essential in the regulation of the autonomic nervous system. And although your textbook does not consider visceral sensation as part of the autonomic nervous system, some others do. And that is why I will end this video with a discussion of visceral referred pain. This picture is from Chapter 13 of your textbook, and it is a map of some of the more common patterns seen with referred pain from internal organs. As you can see, the pain patterns associated with visceral organs are not always in the area of the organ. That concludes the material for the nervous system, for your final exams, and for A&P 1.